At this time, I'd like to welcome and thank our special guests on today's call. John Marcellus, President of the Recreation Facilities Association of British Columbia, and Todd Jackson, Hockey Canada's Director of Risk Management and Insurance. To get us underway and to update the group on the return to hockey resources, I'm going to pass it on to BC Hockey's Vice President of Programs, Sean Raphael. Sean.
Thanks, Keegan, and thanks everybody for joining us today. And as Keegan said, I'm going to just sort of run through and recap some of the resources that are available that many of you may be already aware of, and outline those and address a few of the questions that Keegan mentioned that relate to this area. So overall, our return to hockey plan with BC Hockey in conjunction with Hockey Canada is outlined in phases that'll be shown in this presentation today. And we understand that what's outlined today going into the future is always subject to change and ultimately in accordance with our provincial and public health authorities. But compliance with these guidelines outlined by three major groups: the government itself, the health authority, the sports sector, which is Via Sport, who has outlined sport activity, and Hockey Canada. It's essential to utilize resources from all three entities to ensure that our hockey, return to hockey plans and the sport returning in our communities is done so in a safe way. And all these resources are available right now on our website. And again, they've been circulated and will continue to be updated as we see more information circulated. We're going to look at return to hockey pathway here in phases and a couple of things here. This document also available on our website outlines sort of what these phases look like from the sports sector and how it relates to hockey specifically and timelines. We're not going to spend a lot of time with phase one as part of BC Restart Plan. We've moved out of that, but there is an acknowledgement to that phase and what we've already passed through, both in society and with considerations to our sport, and move into a little bit more in-depth look at phase two. The transition measure phase, which is the one that we're in now, that aligns with the BC Restart Plan as of mid-May, when we saw certain restrictions loosened and guidelines put in place. And notice all timelines that we speak to going forward in the future here in these documents or anything further, again, are approximations. We know that the situation is ever evolving. But in this transitional phase, the certain things that we do know, and particular as outlined by Via Sport in the sport activity guidelines, is physical distancing parameters of 2 meters. That must be maintained whenever sport activity is occurring. That the recommendation of no non-essential travel. So we know that we're looking at sport activity delivered within our own local communities currently. Gathering sizes, no groups greater than 50 people, so we're still dealing with small groups. And of course, this number is variable to how we relate with in the context of delivering the sport, working with our facilities and such, which we'll touch on a little bit later. We know that outdoor activity is the most recommended right now, but we do see indoor facilities either slowly opening, with some of them open already, or starting their plans towards opening along this timeline. So we do know that there is a transition component here that will include indoor facilities, our arenas and rinks. As far as sport delivery goes, it's a non-contact phase, in essence aligning with that 2-meter physical distancing outline. So ultimately, we're fully in a training phase here, but we've gone past the sort of individual training where we can start training within these small groups. Modified play may occur, and play is often what I look to as sort of spontaneous training. It's not necessarily games as we sort of see in a competitive perspective that we may be used to, but modified play can occur as long as all the other parameters are adhered to in those small groups and physical distancing. And then we do understand, based on these limitations, that there may be no or limited spectators, and we have to look at our return to hockey plans and how that relates to our different user groups. What we're ultimately working towards right now is a phase 3, which again aligns with the BC Restart Plan and the activities outlined by Via Sport. And its future date is to be determined, although we can approximate it likely in the fall. Coming out of this phase 2, it could be moved up earlier, and it could be pushed back later, and that's all things that we're waiting from the health authority for further guidelines guidelines on as we translate that to sport and hockey specifically. So things like physical distancing parameters, we don't necessarily know today what that looks like in phase 2, but in a progressively loosened concept, we can expect that it'll be a progression in that direction from the 2-meter distancing that we know of now. Indoor facility access is likely going to be expanded, and we are seeing that in the planning. We can expect increased group sizes. Again, what those parameters are, we again don't know today, but we would expect to see those expanded. We can see contact skills, so pairs or small groups begin to be implemented in this phase. Again, phases aren't 100% black and white either. We will need to assess how we progress through each phase as we move towards the next component of our delivery. We'd expect in phase 3 local, maybe regional gameplay. Again, gameplay to be considered and reviewed and applied as modified, adapted, or working our way to a traditional game format. And then limited spectators. When it comes to those people supporting our athletes, we may see an ability to see that expanded as well as we move into phase 3. And our ultimate goal is moving to phase 4, which is a new normal. And in line with BC's restart plan, this is ultimately tied to what the government has outlined as vaccine or treatment access for COVID-19. And all these guidelines are essentially the non-restricted guidelines. It's back to, again, normal, but new normal. Understanding that certain protocols that we may be putting in place now may have a longer lasting effect on how we deliver programming to our participants in a safe manner. The resources that we're working with in order for local minor hockey associations and members to create their own restart plans follow 3 major resources. So the BC government restart plan, which we're all familiar with. The health authority guidelines basically cover these areas: the general hygiene protocols, the parameters for group sizes, the measures regarding physical distancing, and any travel restrictions or recommendations that are in place, and ultimately the timelines, which again may be approximate now, but may become more clear as we work with the government on that and the health authority. The second primary resource and group that we work with is the sports sector, and through Via Sport. The activity chart you can see on screen, although the details are a little small. The larger resource is available on our website, and we've modeled that previous slide based on what the sports sector provided to us. And what's overseen here is shared equipment protocols and cleaning, transition from training to gameplay scenarios, the transition to contact, and in particular the implications for contact sports like ours, and then that relationship with facilities and spectators and protocols in regards to how we relate what we receive from the health authority with group sizes and physical distancing and put it into our sport environment. And then the last group of primary resources, Hockey Canada, our national sport organization, which is taking the lead on a return to hockey overall. And while we've seen the safety guidelines already distributed, and serves as a great foundational resource, it's the first of many resources to come. And what Hockey Canada is doing is has various work groups together that'll be looking at elements that are important to our local association return to hockey plans, things regarding regulations and registration and how we deal with that through this transition, overall engagement with our customers and participants, certification and training. How do we prepare coaches, officials, and safety people in regards to this new normal and responsibilities that fall onto them, as well as the regular training that we have to go through and how we facilitate that to those that need it. Seasonal structure, which is obviously a very important one. And again, while we know that hockey may not return on the exact particular date everywhere due to local logistics and other parameters, a seasonal structure model is very important to help us plan forward, regardless of what that date means to us. Delivery model, what the programming looks like, what hockey actually looks like in each phase, in a training phase like we're in right now, in a modified play or a small group contact phase like we see in phase 3. And events and communications overall, updates on general events, interbranch events, some of those things that we do expect on an annual basis that come along, and how the communication process is going to occur, and the marketing components that go along with this to make sure we're not only sustaining but growing our game as well. So those are that's an outline of the resources that we have in place right now. Again, all available on the homepage of our website. They are rather extensive and well-made but large documents. We've tried to do our best here in short form to summarize them to help move everybody towards their plans and making sure that hockey's returning in a safe manner in their communities. There are a couple of additional items here. What we're looking to do is establish a few things. Overall, every member should be, if they're not already, but preparing a return to hockey plan that fits their community and their organization. Right now at BC Hockey, we're developing a template for this that should support and assist that we're just reviewing now and hope to have available for everybody very soon. We think that consistency and efficiency to how our return plans relate to each other is very important. As we know, while we are individual members, we work as a group and a team across the province and in the Yukon. Each MHA and district association should establish a communications officer. And for those of you that have reviewed the Hockey Canada safety guidelines and particular section 2, this is a prominent component of the foundation here. Communications officer is vital to make sure that we have that consistent and efficient method of getting the information to the right people and partnering with the right components to make sure hockey comes back appropriately. And then monitoring compliance will be an important part of the return to hockey plan. It's one thing to put a plan together and in place, but it's a matter of monitoring that and making sure that we're adhering to it and providing feedback on how it works, ultimately through some type of reporting process. So the template that we are developing will assist members with the compliance component as well by including some reporting mechanisms so we can gauge where we are in phase 2 if we're ready for phase 3 and so on. So we want to make sure that the members are supported and provided with resource to take those kinds of steps. Some of the member questions, while they won't be exactly word for word, we did receive a lot of feedback and a lot of general topics were shared from the members from the same point of view. So we're going to try to address a couple of them here and hopefully give some clarity for some people. General questions around how many players are on the ice, how many spectators are allowed in a facility, and so on, and various forms came in. And a lot of that is answered in a framework within the previous slides to our capacities of groups no greater than 50 people and to spectators knowing that they may be limited, especially in phase 2. To that end, the best answers here is that there's not one specific number that really works right now, although we do have a range in which we can work within. And the health authority is ultimately the entity that's going to outline those group sizes, and in phase 2 where we are now, we know that's a limit of 50 people. So that's what we're working with. So while it may not be the answer that everybody's entirely looking for, an exact specific number of players or spectators, we know that there's a parameter that we can work with our facilities on to make sure that we can be inclusive. Before, during, and after activity, physical distancing must be complied with at 2 meters, or in a hockey term, an arm and stick length between each participant. Maintaining that group limit of 50 people and the social distance can depend on the facility, the size of the arena, sometimes the size, age, or skill level of the participants. So we know that there will be some flexibility or variance in how this is put into place. And then communication between members and facilities regarding limitations is going to be vital. Sorry, there's a little bit of feedback there. I'll repeat that last point. Just the communication we see for determining how many players and spectators are allowed in these facilities and on the ice. The communication between our members and our facilities is going to be very important in developing that as part of your plan, because again, it may vary from member to member and facility to facility. So that communications officer creating that point of contact is going to be very important. Sort of the last collection of questions that came in that related to these resources, timelines, so start date, seasonal structure, delivery of hockey programming, what does gameplay look like, what adaptations need to be made or modified, what rules and procedures need to be reviewed, and is there inter-member or provincial travel allowed? All of those types of questions were very common from the membership. So again, timelines, go back to the health authority as we move through the various phases. That is really going to be at the determination of the government and the health authority as far as how and when we can move to that, and then it's a matter of us adapting in our sport. There's a recognition that some municipalities and regions will have different starting dates. So again, like I said before, we're not looking at one particular point on the calendar that's going to be a catch-all for everybody. It is going to be based on the local health authorities as well and the facility accessibility. If a facility is yet or certain precautions are being put in place, that's obviously something that's going to be dictating when we start programming. Hockey Canada has a number of task teams that are focusing on items that was mentioned earlier, but in particular, seasonal structure and delivery model is meant to address hockey programming specifically and what it looks like in these phases. And we do have BC Hockey members that are included on some of those task teams. So even at the development level, we're working hand in hand with the national sport organization on developing that, and we're expecting these resources to be in this next phase of communication coming out of the safety guidelines. The last sort of common question circulated around competition in games, and obviously everybody's eager to see us get to that point. We know that there's elements of phase 3 and 4 as they comply to whatever guidelines come out from the public health organization and authorities that will include that. Again, what they entirely look like, we don't know. But what we do know again today is that we're in phase 2, and phase 2 is looking specifically at training, skill development, fundamental movement. And I think that a lot of our sport activity leaders are equipped to deliver this, and that's where our phase 2 planning will be developed from. So that was sort of a collaboration of a number of questions. Not all the questions that came in, there are some more that we'll address later, but those are the ones that related sort of to the topic of the resources that we have in place, our pathway to return to hockey, and ultimately what we need to know to start building our plans. Also joining us, as mentioned, John Marcellus, the president of RFABC. Obviously a very important partner here for all of our members as we move forward and work with those facilities. We will pass it over to John here to address the group.
And John, just a reminder to unmute yourself. Perfect, thank you.
Yeah, okay. I hope everybody can hear me. Good afternoon, everyone. And to begin with, Keegan, I'd like to thank BC Hockey and Hockey Canada for the opportunity to be involved in today's discussion. I've been involved in numerous discussions over the past couple of months regarding the COVID-19 pandemic, and information sharing such as today's webinar are proving to be very valuable. As we move forward with reopening recreation facilities, it's essential that facility operators and sports organizations continue to develop that relationship, which are effective for collaborating and cooperating on their strategies and protocols. And those strategies and protocols are necessary to ensure the safety, health, and well-being of all those persons who are going to be at the facility. Sean alluded to that collaboration previously, and it's going to be essential as we move forward. When recreational facilities closed, or originally closed in March due to the COVID-19 pandemic, it was as a very cautious approach or response to address reducing the spread of the virus. And I think those words are very key to what is going to be the strategy moving forward. We need to reduce the spread of that virus, and we are all aware of the terms by now of physical distancing, proper personal hygiene practices, physical and administrative controls, and cleaning and disinfecting. And those are all important facets of the response. These have proven to be effective and subsequently remains our focus today, and it should be the strategies we need to establish and continue developing in our facilities. Via Sport BC was referenced earlier in this webinar, and so I would point you in that direction. They provided some guidelines with the approval of the province, as has BC Recreation and Parks Association. And that was for the return to recreation and sport in BC. And if you haven't read those documents or reviewed those, they have some excellent reference material in there and will be really helpful as you move forward. Many recreational facility operators have already begun reaching out and are initiating dialogue with LSOs, the local sports organizations, on a return to sport and hockey plan. And the intent is to provide some insight for a possible restart or reopening. As we reopen or restart the facilities and of course the sport of hockey, We need to ensure that everyone understands the role and responsibilities of the facility and the local minor hockey association, the rep or junior teams, and how those two organizations need to collaborate on ensuring the health and safety and even the well-being of each organization's members, volunteers, and employees. There are the employees or workers in the facility that provide the support for the activities of hockey, and then there's the public that are using the facility to enjoy their programs. We need to ensure that each are a priority, and we need to strive to ensure their safety. We're faced with regulatory and safety requirements that need to be met, and so each facility has or is in the process of developing a plan specific to their facility to eliminate or minimize that risk of exposure to the coronavirus. It's also equally important to be aware and understand that, as Sean alluded to, no one plan is going to be the same for all facilities, and that's because of our unique characteristics and layouts. Local minor hockey associations have the guidance of their governing bodies provincially through BC Hockey and nationally through Hockey Canada, and in developing their own plans for their participants and their members. And so these plans need to align with the facility plan. And as we've already heard, keep in mind that while most have a home facility, there are those that may be using more than one facility. And so start planning and having dialogue with those facilities as well if you haven't already done so. Those recreation facilities are unique to each and every community based on the size of the community, the demographics, and the geographic challenges that are out there. So reopening dates will differ across the province, as will their safety plans. So the big question is, so where do we start? And I'm sure everyone is at different levels with that question. The best foundation to anything is to contact your facility representative that you typically correspond with, as they're going to be looking to you to provide information of the details for your planned programs. This will also help them in the information needed to make a well-informed decision of when to establish a date for reopening. I've heard from a number of facilities, not only throughout the province, but across the country, that are looking at different dates, and those are all dependent upon those parameters that I've just spoken to. The one thing that's going to happen is you need to discuss the details of your programs and collaborate on how to support each other. It's most certain that reopening programs are going to look very different, as has been suggested, and the facilities are going to look different. We need to know that the facilities will have in their plan specific details, and those specific details, I'm going to touch on a few here, but these are not all encompassing, but some of the things that come forward to me. And one of them is the minute you come to the door. When you come into the facility, some places, some facilities are going to look at implementing screening of patrons and the employees as well. And that could be through a series of questions, but the whole objective here is to make sure that no one's allowed if they display symptoms of illness. And if they are, they're going to be encouraged to stay home until the symptoms have passed. I know that many facilities, such as the one I'm in, are looking at rooms that if symptoms of illness start to be displayed once you're in the building, that we can put them in an isolation area until they can be transported home or where they need to go to if it's a medical center or whatever. So those types of situations are going to be in play as well. One of the big ones that keeps coming to me is, how do I know the occupancy levels and what are the maximum occupancy levels in venues within the facility? Sean again alluded to some numbers based upon the guidelines from Via Sport, and they are guidelines and they're good. They need to be adjusted for each facility based upon the facility's unique characteristics. For example, if dressing rooms are going to be used and they're limited to 6 to 10 persons rather than your normal situations of 15 to 20, then how is that going to affect your program? You need to worry about putting into play a means of egress so that you can continue to maintain those physical distancing requirements. Do you need additional rooms, and are they available? Questions we need to ask. Do players or participants come dressed and have an area strictly for putting on skates? And how much time is allotted for changing? And even the fact, are dressing rooms available for use? Those are all questions that need to be hammered out between you and your facility representative. And I'll tell you right now, the facility operators are more than willing to help in development of plans and that, so we come up with something that's effective. They're going to also be wanting to implement plans around what the plans for pickup and drop off of players are for your programs. and then the access and exit within the facility, and not only in the facility, but to the venues in the facility. Many recreation facilities have more than one ice surface, or they have meeting rooms or fitness rooms, and those are all going to have to be discussed, because the flow of traffic within your facility is likely to change, and you're going to start seeing more signage, more floor markings addressing those types of situations. So another one that keeps coming up, what's expected for supervision and spectators allowed. And we're looking towards a lot of input from BC Hockey, the local sport association, Hockey Canada, and the hockey sport bodies, because we need to know first off what kind of program you're putting together. How are you going to maintain the requirements around physical distancing? And then how many people are going to be involved? And that's going to help us put together an idea of how to handle supervision. And then if we're going to allow spectators. I know a lot of people are looking at the premise that maybe there's allowance for, if you have 12 hockey players in a session, that one adult be allowed for each individual in the session. That'll change, that'll differ. And so contact your facility operator to work that out. Another one is going to be parents. Are they going to be allowed to accompany the children into the facility or with siblings? And those are things that you're going to hammer out as well. A couple small details, but they shouldn't be missed, is that on the hygiene side, most places are going to have their water stations shut off. So you're going to have to look at supplying your own water bottle and things of that nature. And of course, if you're in a dressing room or in some scenario of that nature, providing your own towel and your own hand hygiene, washing soaps and things of that nature. And then, of course, lastly, one of the things I want to touch on is that and I think every facility is probably challenged with this, there's going to be areas where physical distancing isn't possible, and then facilities may be requiring that patrons are wearing masks. That's where, if we look at all the things I've suggested here, having that collaboration and cooperation with your facility operator is going to go a long ways. And those are just a few examples of those changes. The other thing, as we've mentioned already, establish a plan that's in accordance with your PSO and NSO, your provincial sports organization and national sports league organization. And Sean mentioned it, and it's very true. The province's health directives, they're going to have to be aligned with our programs and our facility plans. So I think the template being developed by BC Hockey will be a very valuable resource to assist and support in establishing your return to hockey plan. And then work into your plan a means for enforcing the plan, as there will be challenges in those areas. And having it addressed prior to reopening will afford a proactive approach and can be helpful when the need arises. We've seen in various areas of the country where physical distancing, which essentially is our first line of defense for preventing the virus from spreading, is not being practiced. So how do we enforce this when it occurs during your programs? I'm sure everyone can appreciate, and no one wishes to digress to the conditions that we observed and experienced in March and April. So we need to work cooperatively to communicate that message of safety to everyone. And then once established, ensure that you communicate it out to your members and participants. And facilities may be able to assist you and support you with that communication through websites, signage, and perhaps some other media opportunities. And I'm sure Todd's going to talk about this next one, but risk management is going to be at the forefront of all of these plans, and it's going to be timely, his information and his presentation. But I would like to say that having your risk manager involved with the facility operator is going to be essential, and I'd recommend that once you have that plan established, that you do a walkthrough of your facility and plans prior to reopening. In addition, ensure that you review your facility use agreements and permits and understand any insurance requirements, especially involving your members and volunteers. And then keep everyone informed of any changes to the plan. We are reopening, it's restarting gradually in phases, and so keeping in tune with changes as restrictions ease or tighten is going to be needed. If we can be certain of one thing, it's the uncertainty surrounding COVID-19, so we need to be able to adapt as the situation unfolds. The provincial health officer and the province could revise their directions and directives at any time, and so we need to be able to respond and recover accordingly. In a recent discussion I had here with some of the people in our organization, it was described to me that this whole situation isn't similar to turning on and turning off a switch, but rather a dial where we can turn it back or forward as we move forward. And it's going to be essential that we're able to adapt in that process. So again, communication, it's going to be essential between the facility and groups. And then develop an awareness program with the facility that explains where, how, what, when, why, and why we've taken the steps we've established. While the current conditions are going to eventually pass and we will return to normal, it will be different in years to come. And many of the proactive and preventive steps taken now are going to continue into our new normal. So again, communication and education, essential to create an understanding and acceptance of this approach. And what's the objective? Well, we want everyone to enjoy our program safely. So with this in mind, we need to establish strategies and protocols in our plans to last the test of time and be long-term solutions. The Recreation Facilities Association of BC, like BC Hockey and Hockey Canada, have networks and resources available across this country. So use those resources as we are all in this together. So it's a given. Things are going to look different as a facility when it reopens. So plan ahead, visit, work with your facility operator, and you will notice changes, and you're going to probably be inundated with signage and things of that nature, but help us work out any kinks. Let's work together on this. So in summary, BC Hockey's put together this valuable webinar and will continue to provide resources to support your organizations in your return to hockey plans. Your recreation facility is doing the same. And so don't feel overwhelmed or unsure of what direction to proceed. There have been many people that have expressed to me that they're feeling stress and anxiety, but by all of us working together to ensure that our members and our communities are able to enjoy hockey safely, we can put the fun back in recreation in our national games. So Keegan, I'll turn it over to you.
Great. Thanks very much, John. Really appreciate you taking the time today and your very informative presentation. So thank you very much.
Welcome.
At this time, we're going to send it over to Todd Jackson, who is the Director of Risk Management and Insurance with Hockey Canada. He's once again joining us to speak on the Hockey Canada safety guidelines that were released last week. Todd, again, appreciate you taking the time out to present to the BC Hockey membership. Take it away.
Thank you, Keegan, and thank you to everyone at BC Hockey and to Bill Green for having me on. This is the first step in your planning as you start hockey. We are in a situation where none of us have ever seen this before, and everyone is learning. And as was said earlier by John, things change daily. We look at a guideline, and all of a sudden things change, and there's a further restriction, or a restriction gets relaxed. So I think the key as you move ahead over the next little while is going to be flexibility. We're all going to have to be flexible. We're all going to have to be able to work with the facilities, work with the province, work with your member, and make absolutely sure that we keep open minds and allow that flexibility to be part of our everyday planning. We're going to have patience, because I think we all know that it's not going to be the same. There's going to be a long road to that new normal, however that new normal is going to look, and we're going to learn along the way. And there's going to be things we're going to do really right, and there's going to be things where we have to step back and say, oh no, we've got to relook at that, and certainly work with the people we need to work with. I will go through the manual real quick. I don't want to certainly go through it in detail. I will give you a little bit of an impression of where we've come from with the manual. As some of you know, as looking through it, the manual is really positioned as a national type of document. We realized very, very quickly as we did this that as we went through everything, we really had to make it broad enough that it would meet the differences in every province, the differences in every facility, the differences of all the members. So I think it's really been positioned as that. It's been positioned as a guideline. It's been positioned as information you can take and build in your BC Hockey plan and work with your province and your facilities in starting hockey back up wherever you are. I really want to stress that this should be in concert with public health authority and your member guidelines, and I know you and your facility guidelines. I know you've heard that again and again and again, but I think we really have to realize that protocols are really managed at that provincial territorial level, and you know, we're finding that out very quickly as we see things open up in different pictures in different provinces. And I live in Ontario. Ontario is very different than obviously what's happening in BC, which is very different than what's happening in Manitoba. It's really, and this was said earlier, so I won't spend a lot of time on it, really, really important that you as associations put someone in place who can be that communicator, who can really take that lead in facilitating communication with your member. So with BC Hockey, with facilitating communication with perhaps your public health authority, and facilitating communication with your facility. And that person becomes the person who monitors relevant updates, who monitors things that are happening on a daily, on a weekly, on a monthly basis, and how things are changing. And I think that really becomes part of what John was talking about, and you know, in the communication and keeping updated and making sure things are communicated back and forth, really goes to that whole success factor, if you will. Also in the manuals, our checklist to success, and that was shown a few slides ago. Again, I won't go into any detail of it, but go through it. It's a one-pager. It tells you what we think you need to do from a provincial territorial health authority guideline standpoint, to a local health authority guideline standpoint, to your member guidelines, and to the requirements, if you will, within your facility. The planning is key, and that was said that earlier, that planning is so important as you move along. Meet with your parents, meet with your participants prior to anything starting. Make sure they understand what to expect, what the safety steps are, why you're doing what you're doing, and how the game is going to look different, how the activity is going to look different. And meet with your facility, which was talked about earlier, is very much stressed within the manual as well. There's a small section in here on facilities as well, and I really want to thank John for coming on. I can't stress how important this has been. When we put this manual together, we had a task team, and on that task team sat representation from the facilities world, and I can tell you that that was one of the best things we did. We were able to get the facilities point of view, if you will, and we were able to get the point across that in order for us to operate facilities, or we have to have facilities operating, and in order for facilities to operate, they've got to have that flexibility, cooperation on both sides, and they have to have that communication. So that just stresses, I think, what John said earlier. There's an insurance section in here, and I know that you've touched on insurance quite a bit within the province in probably in the last few days. Certainly, we are very lucky as an organization. Our liability policy, so our CGL policy, we're in a situation where the exclusion on communicable disease does not exist. So basically, liability claims against Hockey Canada, against BC Hockey, against the Minor Hockey Association would be addressed by that policy. And like any claim, of course, it's got to be assessed and looked at. But I think that's very reassuring for you and very reassuring for us as we go through this. So, but it doesn't mean that you don't continue to enforce the risk management guidelines. And that was said earlier. The risk mitigation is so important, because if we don't risk mitigate, then there could be a chance of an outbreak. If an outbreak happens, then we back up and everything starts again. So important that although yes, we do have some insurance coverage there, also important that the risk management guidelines are kept in mind and you continue to put those in place. This was also said earlier, really important that you review your rink rental agreements and what clauses are in there with respect to COVID-19. If you don't understand the wording, get somebody who does. who's good with contracts, who can look at that for you, and at least then you know what exactly you're signing when you go to sign your facility contract. Hygiene is the big section, obviously, within our guideline, and again, I want to really stress that these are guidelines, these are recommended guidelines, but they work within your public health authorities guidelines and your members guidelines, so BC Hockey's guidelines. I really put it to 4 pillars, and these are the ones that you see all the time. It's the physical distancing, it's the washing of hands, it's the hygiene when you're sneezing, it's the cleaning and disinfecting, and it's if you're sick, you're not in the environment and you're not around people. Those are so important, and you're going to see that a lot of what we put in the hygiene area really go back to those pillars as we work through it. And we also address masks in there as well. You'll see certainly, again, I think in a lot of cases we're going to see provincial governments, we're going to see facilities, those kinds of entities come out with certain guidelines with respect to the wearing and not wearing of masks. But I think certainly it's another layer of protection. The important part of it, obviously, is that masks aren't the be-all and end-all. You still have to follow the other guidelines that are in place, such as the social distancing, such as the good hygiene, such as all the things that have been asked of us as a society, if you will, to prevent COVID. There's a bit on travel in here, and this is way down the line, folks. We did put it in here, though, so when we get there, when we get to that phase 4, where things are moving a little quicker, and we're in that phase where we may be traveling, a little bit of information in there for you as well on that, with respect to hotels, with respect to travel itself, travel restrictions, watching all the things that you need to watch if you will be traveling to another area. We've also put in here a recommended type of kit, prevention kit, travel kit, however you want to position that. Things that kids can carry with them to the rink, the players can carry with them to the rink, packages of tissue, perhaps a bottle of hand sanitizer, a prevention card with maybe key reporting information, and those types of things that they may need on site at the facility. We have a fairly in-depth recommended return to play procedure, and it's kind of broken down into participant feeling ill to a player saying, well, I can't come to the rink today. He calls the coach, or she calls the coach, can't come to the rink today, and I'm not sure why, I just don't feel well, to I have symptoms of COVID-19, to I have been tested and I have COVID-19, a positive COVID-19 test. So those steps are in there as well. I really, really want to stress the importance in those guidelines with respect to the public health authority and with respect to the physician. That has been stressed within those guidelines, I think, and ones that we need to make sure that we pay attention to. At the same time, you want to work also within your public health authority guidelines with respect to any type of testing, of any type of tracing, contact tracing, all the things that need to be done in the case of especially a positive or a suspected COVID case. There's a little section here on junior hockey. I know that some of the junior hockey leagues are coming up with their own guidelines, and you will see more of those as we move forward. But there is a kind of an outline that's specific to junior hockey that's in there. We've covered officials in here, and we feel that officials are a different entity with respect to some of the prevention, some of the things that they're going to be faced with from a risk management standpoint. For example, the officials room. You go into an officials room, it's fairly small. You know, how do we deal with that type of situation? So that's certainly addressed within that manual. We have a series of resources within that manual, everything from public health authority assessment tools to travel advisories to provincial resources to federal resources, and hopefully it will be a real benefit to you as you build your resources both within the province and obviously locally within your minor hockey association. The other section I will talk about are roles and responsibilities, and I'm going to talk about the safety person in a minute because I believe it was one of the questions, but the roles and responsibilities for each, for the administrator, for the coach, for the safety person trainer, for the player, for the parent, are all in there. And we really tried to break down, although a little repetitive to what's in the manual, it kind of breaks down what falls under what category with respect to responsibilities. And then the hygiene checklist, which is Appendix B of that document, again, very repetitive of the hygiene section, but just a simpler form, and one that talks about, do I do that prior to the season, prior to arrival at the event, after the event, or travel to tournaments. So that is really the manual. I hope that gives you a little bit of a picture. I know some of you have gone through it anyway, but that gives you a little bit of picture of what that manual is. And I think there were a couple of questions as well, Keegan. I'm not sure.
Sean, did you want to address those?
Yeah, so thanks, Todd. First of all, lots of really good information, and it does touch on a lot of our questions that we did have, but I'll go through a couple of the collaborative questions as well. So, from the members, we got questions about the role of that Hockey Canada safety person related specifically to COVID-19, and a couple points that we had here that I can cover, and then I'll throw it to you, Todd, for any additional comments you want to make. But some of the things that we've begun to outline here is that everybody is responsible for the self-monitoring and providing the notification of illness, and that's touched on by both Todd and John previously. During activity, the HCSP person would initiate the safety protocols that were mentioned from that guideline. Doctor's notes being required when participants are removed from activity due to illness or there is a confirmed case prior to them returning. And pass it to you there, Todd, for anything.
Yeah, no, absolutely. And those are certainly key for sure. I will tell you, we are working on a learning experience that will hopefully enhance not only the safety program, but I think for any volunteer, which would come in the fall. And we haven't got it 100% nailed down yet, so I won't make a 100% commitment, but we are working on that type of format that would address these types of things. Certainly from a safety person standpoint, and that's true and dear to my heart, obviously, as I was a trainer for many years, but so working towards the health and safety of the player, and a lot of this stuff you're going to find is already part of the safety program. The safety program talks about hygiene. It talks about non-latex gloves when you're on the bench. It talks about a lot of the different things, and really all we have to do is enhance those around the COVID pandemic. So, but working towards that health and safety of the player, perhaps advising your team on a prevention kit, and working with your parents on the team on what that prevention kit will look like, the tissues, the hand sanitizers, those kinds of things. Water bottle management, really important. It was mentioned earlier. Are we bringing water to the rink ourselves? Who's going to manage those water bottles? Who's going to stress that those water bottles get washed? And who stresses to the kids you don't share them? That's one of the biggest challenges, especially when you get to the young kids who are just grabbing a water bottle randomly. Emphasizing the hygiene steps to your parents. Have a parent meeting. Get them involved with what has to be done, and that might have to be done virtually, just like we're doing right now because of the situations within particular areas. Certainly stressing the physical distancing is so important, and that's between the trainer and the team as well, or the safety person and the team as well. That social distancing or physical distancing is so important, and if you're not physical distancing, then that question of a mask comes into effect, where we should probably put one on if we can't physical distance in a certain situation. Monitoring the players' return to play, as was said, Sean. I think it's going to be important, much like concussion. I'll compare it to concussion, I guess, from a return to play standpoint, and how important that is. From a COVID-19 standpoint, it's as important and even more crucial, I think, right now, that we pay attention to it and make sure that if a young player is not feeling well, and a young player either goes home or calls sick or calls with COVID, they go through the process, and it's laid out in the manual, and that includes public health and or the physician, and that's really, really important, and that they're cleared to come back with that note to come back to play. And it may be difficult in some cases, we realize, but I think it's something we have to work and strive for, because it's so important that we know they're healthy before they come back, obviously, into the environment. And there's also all the requirements around isolation that exist within the province, and those are going to change as restrictions loosen up. Those will change, but really, really important. I talked about the gloves, washing your hands and getting the kids to wash their hands. Again, really challenging sometimes, especially in a hockey environment, but really important. Making sure kids are cleaning their equipment and keeping the equipment clean. Again, that can all be part of your parents' meeting at the beginning. Talk to them about it, and making sure that they understand. Undergarments especially are really important to clean, for sure. And certainly sitting with the team and coming up with plans for each facility you're in. And you know, I thought John made some really good points facility-wise. Every facility is going to be different, and you may have to work with that particular facility to say, okay, guys and girls, this is what we're going to do. This is how we are going to manage this situation in the facility. Everything from physical distancing to possibly not having change rooms to all the things that you may get affected by within that facility. So those are things, I think, from a safety person standpoint, you're going to see. Again, I don't think it's that much different than what you see in the program now. It's just enhancing it and making sure that we're being very, very aware of what we're doing as a safety person.
That's great.
I hope
Thank
that
you.
answers it.
Yeah, no, that's great. Again, thanks, Todd. That encompasses a lot of the various questions that came in specific around the safety protocols, the safety person as well. And I think that both you and John have reiterated that communication and collaboration component as being so important. We know with
very important.
so many of our members even share facilities with other members, so even member-to-member collaboration on their individual plans is going to be important as well as we all move forward. So thank you, Todd, for joining us and sharing that information. At this point, I'm going to pass it along to Jeremy Ainsworth, our Chief Program Officer at BC Hockey, just for some closing comments.
Great, thank you, Sean. And just a couple of closing comments from my end. First off, we want to extend our gratitude to both the RFABC and Hockey Canada for joining us today. Great job, Todd and John. I thought the presentations were valuable for our membership as we work our way through some uncharted waters here. We really want to thank you for attending today's meeting. The amount of participants that were involved today certainly demonstrates a great passion for hockey in BC and the commitment to the game. We're maxed out at over 250 people through the majority of the session, which is absolutely great. Secondly, just want to update and assure that we will continue the member engagement process. Return to hockey will be the focus for the immediate, but this type of forum is available for other topics as well. Please let us know if you have an agenda item or if you have an idea for a presentation that you'd like to see. We would like to see this platform used as a mechanism for our members as well. Opportunities here to share their successes and best practices. Through our district associations and leagues, we plan to reach out and seek local leaders who want to share, and we're going to be more than happy to assist with any preparations to do so. So the stage is there for you. Take the opportunity. Along with a recording of today's session, BC Hockey will also distribute a survey. The purpose of that survey is to obtain your feedback and collect input on today's session. It's important that we hear from you on your feelings of this session. We need to know that we're hitting the mark. And if there's any questions that have been missed, or there's anything that you can identify, we can follow up. That's important to us so that we can ensure we're getting you the information. On that note, please take the time to complete that survey. again, it's a collective effort, and we'll appreciate your feedback. We'll conclude today's meeting just by saying that we hope that you found it informative. Again, we'll post that recording. Take a look at that. Please pass that along to others that weren't able to get on today or too busy to do so. And we appreciate everybody's time. With that, everybody stay safe and healthy, and thank you very much.